Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. A lot of people come in for consultations regarding their abdomen and their flanks, if you will. These patients vary in different ages, and people want to know, Dr. Shapiro, what is the difference and who is a candidate for abdominal liposuction versus a tummy tuck? The best way to understand the difference between the two is understand the techniques. Liposuction is performed by putting some fluid beneath the skin, allowing that fluid to sit for a while so it causes vasoconstriction, so there's less bruising and bleeding, and then a small cannula, a small tube, is placed beneath the skin and that fat is evacuated. It may seem like a simple thing, but in fact there's a lot of finesse that goes into that procedure in terms of contouring the body in an appropriate way, not removing too much fat. In certain cases where we want to stimulate some skin contraction and make the skin tighter, that is something that we can do. But still, we're always limited by the skin tone. To get a great result with liposuction, we need to temper, we need to balance the amount of fat that is removed with someone's skin tone. So if we take out too much fat and someone has some poor elasticity, oftentimes we'll have to go back and remove some extra skin. When somebody, I think, has too much extra skin or has an abdomen that has poor elasticity and has fat that needs to be removed, but still we can't do that without removing extra skin, that would be a candidate for a tummy tuck or an abdominoplasty. Also, after changes in weight or after childbirth, the muscle wall of the abdomen will also loosen, and that's why people get a bulge that is refractory to attempts at exercise and weight loss. So only a tummy tuck can address that, because with that procedure, I will make an incision very, very low, the abdominal wall is elevated, and then I sew the muscles very tight to give you a contoured abdomen. Those changes cannot be addressed with liposuction. Liposuction is purely a contouring procedure and does not address the muscle wall. There are different types of tummy tucks. There is a mini tummy tuck that really just addresses the abdominal laxity, fullness, and bulges beneath the belly button, and then a full tummy tuck that addresses the whole abdomen. The recovery, I think, is a little bit different between the two. There is no incision with liposuction other than the small incisions where the tube is put in. Hence, the recovery, I think, is easier. Still, it takes a while to see that final result, up to 6 months or so. A tummy tuck has a longer incision, so there are recovery from that. Also, oftentimes, we'll have drains placed with a tummy tuck to evacuate any fluid that forms in the first week or so, so that will prolong the recovery. And lastly, because those muscles are tightened on the inside, that adds some post-operative discomfort that we deal with some pain medications, some muscle relaxants, etc. So the best way to figure out whether you're a candidate for liposuction versus a tummy tuck is come in for consultation, tell me what you're looking for, I'll tell you what I can do for you, and we go from there. Thank you.